You'll be pleased to hear that actually I'm not going to talk for 15 minutes. I'm only going to do 5 minutes of a global overview on some of the statistics related to melanoma. This is really impressive to see such a huge attendance here at one of the final sessions of the meeting, and this is quite an impressive global international panel. Nothing to disclose. Clearly this is a very hard to read slide, and all I really want to point out here is on a global scale, melanoma is one of the rarer cancers. In fact, worldwide it's ranked number 19, making up only 1.6% of cancers worldwide. But if we look at countries that have got a high rate of people with pale skin, the rate increases dramatically and increases further when you look at countries with high sun exposure. So in the US it's ranked number 5, and in Australia, in males and females, it's ranked number 3 in terms of incidence. Now, Australia has got the highest incidence in the world. 1 in 17 patients or people will develop melanoma by the time they reach 85 years of age, and it's 10% of all cancers that we treat. It is important, however, to mention that as a proportion of total skin cancers, it's very small. And in fact, in Australia, the rate of non-melanoma skin cancer is so high, we don't even register it. So it's a very small percentage of total skin cancers, but importantly, it makes up 75% of skin cancer deaths. It's also important to see that although the peak incidence happens around the 6th and 7th decade, within young patient groups, 15 to 40 years of age, it's the most common cancer. And in the even younger age group of 20 to 34-year-olds, it's the most common cancer death, even though, again, we see the majority of deaths later in life. Unfortunately, melanoma rates are increasing and have increased over the last 20 years twofold. And in 2010 we had 11,000 cases in Australia. 2014 it's predicted to be at 14,000, and by the time we get to 2020 we're looking at 17,000 cases in Australia alone. If we break it down a little bit more, we can see that it's mainly in the males that the incidence is increasing. And if you look at the mortality rate, in the females it's remaining fairly flat, but in males we are seeing more people dying of melanoma as time goes on. But the actual mortality rate, the incidence, is going down in males particularly, and in females. So we are curing more people with melanoma. So that's the good news. And at the bottom there's US data. In 1975, the prognosis at 5 years was 82%. 2006 it was up to 92%. So there's been fairly important and significant inroads. But why are we actually curing more people with melanoma? Well, I think to answer that, at least on one level, we need to look at the predominance of the breakdown of stage. Most people who present with melanoma have localised disease. Much of our discussion, however, is about management of the regional lymph nodes, and much of the discussion is about management of recurrent and distant metastatic disease, because these are the real trouble areas. But in fact, the major impact in survival has not been on regional disease management or distant disease management, it's been on appropriate local therapy. And it's questionable how much impact we've had on metastatic disease to date overall. Two very important things that have occurred are prevention strategies, and in Australia this was a very well-known campaign of the slip, slop, slap, slip on a shirt, slop on some sunscreen and slap on a hat, and this has had fairly impressive reductions in the rates of skin cancers overall, particularly in the young age group. So we're seeing the incidence of melanoma going up, but if you look at the actual younger groups of patients, the incidence of melanoma is starting to go down. Also, early detection is very important. So I'm going to move on now to ask Dr. Goncalves to come up and present his talk. Thanks.